Welcome back. Did you know obesity is recognized globally by experts in medicine as a chronic disease? Our next guest says obesity is not a choice. It's a condition that can be managed with the help of experts.
And here with more is Dr. Deborah Horn, UT Physicians obesity medicine specialist, along with her patient, Lisa Salazar, who is down more than 60 pounds thanks to the help of UT Physicians. Ladies, welcome to the show. And Lisa, it's great to see your big smile when I just saw the amount of weight that you have lost. But before we get to your story, Dr. Horn, let's first talk about how obesity is not a choice. I think a lot of people have misconceptions when they hear that word obese.
Yeah, I think that's really true. For a long time, we thought it was really in our control. Now we understand that, like many chronic diseases, it's disease. About 50% of what happens to us in terms of obesity is our genetics, and about 50% is how our genetics respond to the things in our life. So it's really important to understand that just like diabetes or high blood pressure, obesity is a disease that you need to see your physician to be treated.
And doctor, when it comes to a chronic disease that needs to be treated, a lot of people may be, out of sight, out of mind. They hope that if they just don't acknowledge it, it's going to go away. But this is something that people should be seeking expert help with, correct?
It's very true. And part of the reason is because we now understand that obesity is the underlying cause and or related to more than 236 diseases. And the reason I say more than that is because now we've added COVID-19 as 237. It increases our risk of severe infections with COVID. And so as we think about all those things related to diabetes, we really recognize that if we treat the underlying obesity, we can get at so many other diseases.
Well, Lisa, we want to hear your story. The moment that you found yourself in Dr. Horn's office, where were you in your life and where did you see your weight loss goals? Did you feel like you could overcome it?
Yes, definitely. Obesity is something that is hard to talk about, but I think that it's important to realize that it's not just recognized as a medical condition, but also there's an emotional component that goes into it. Oh, look, there I am.
Wow, the before and after.
Yeah, that was at the beach a couple of days ago, my after picture. There's an emotional component that goes into it, and I'm a mom. I have 2 young boys. I also work as a nurse practitioner, so I'm full-time working and running around the hospital. So there's a lot of other things that go into it. And so when I stepped into Dr. Horn's office, I knew that I needed to get healthy, and I was at a point in my life where I was ready to do that and take it seriously. And so she's helped me navigate the issues, with my schedule and working night shifts and 24-hour shifts, and also how to be effective with it and how to stay with it. I've been doing it for 18 months, and it's been very, very successful. So I'm really happy with the progress.
And Lisa, I'm so glad, thank you, first of all, for sharing your story and being so honest with us. I'm so glad you mentioned the part about it being an emotional issue, because we're all just trying to survive, right? You mentioned like being a busy professional and a mom and a spouse. All of these things can factor into what we're dealing with every day in life. When you found yourself in Dr. Horn's office, you had vitamin deficiencies, you were pre-diabetic, and you just mentioned you were concerned about your health. Talk to us about where you are today. We just saw the before and after photos, but I understand that you're on a plan that doesn't just include diet and exercise, but a whole range of things.
Right, definitely. So whenever I started this journey, one of the very first questions that she asked me was, how do you feel about this taking at least 2 years for you to get down to your goal weight, or weight that you and I both feel it works for you? And I was like, it took me 12 years to get where I am now. So what's 2? I mean, that sounds great. I won't even be 40 yet. So let's do it. And just like her positivity and support has really been instrumental in me being successful. And so I had my lab work done about a month and a half ago, and I'm actually, as Dr. Horn put it, a cardiologist's dream right now with my cholesterol numbers, and my A1C has come down, so I'm no longer in the pre-diabetic categories anymore, which feels great. That in itself just feels amazing to really have put in the effort and then to see it reflected in the numbers.
It's really great, too. And Dr. Horn, this is all about a lifestyle change. This is not about crash dieting. We know what happens when people do that. When you deplete yourself of something, I think we find ourselves in overload and almost in a worse situation than before we started a diet. But this is a mind shift of lifestyle and getting yourself healthy. And I think it's wonderful that when you talk to Lisa, how do you feel about this taking about 2 years? This is not something that's going to happen overnight.
Yeah, Courtney, I love that you bring that up. And, Lisa has just been such a beautiful example of all 4 pillars of obesity care. She has embraced her own individualized nutrition plan. She is very committed, along with several partners that she works with, at her physical activity goals. She uses anti-obesity medications to get to her goal, to control that physiology that's not right in her body, that let her body struggle with obesity. And probably the most important component she mentioned herself, which is what we lump together as behavioral modification, but it includes the emotional part of the disease, the mental part of the disease, the sleep, the stress, and managing life in general. And she's just a terrific example of, at COMMP, we just give our patients the tools to succeed, and they really have to embrace it and put those tools to work. And that's exactly what she did. And that's exactly why she's where she is today. Just a model of health, both inside and out. When we look at the scale, when we look how she feels in her life, and when we look at her labs and physiology inside, everything looks great.
All right, Dr. Deborah Horn, Lisa Salazar, thanks to you both for your time. We do appreciate it. And Lisa, congrats on your shift in your life. It's fantastic.
Thank you so much.
We should point out there are 3 locations, and for more information on the UT Physicians Center for Obesity Medicine and Metabolic Performance, you can visit utphysicians.com or call 888-488-3627.
Giving so many people such hope and a really great outlook on life, for sure.
A long life.
We'll be right back.